Thank you for the opportunity to present at this conference today. I'm representing the Blood Matters program today in this presentation. I thought I'll start off by introducing the Blood Matters program for some of you who might not be familiar with this program. It is a collaboration between the Victorian Department of Health and the Australian Red Cross Blood Service, with a key focus in improving transfusion practice clinically. As part of the program, a red cell audit was performed in 2009, which is a repeat of the red cell audit in 2005. And this looked at the local trends of red cell usage in the setting of orthopaedic surgery and how this compared with the current clinical guidelines. The NHMRC ESBT guidelines provide recommendation in terms of red cell transfusion, and that indicates that transfusion should rarely be withheld if a hemoglobin is less than 70 grams per litre, and conversely, transfusion should rarely be, if a hemoglobin is less than 70 grams per litre, transfusion should rarely be withheld, but conversely, if a hemoglobin is greater than 100 grams per litre, transfusion should rarely be given. If a hemoglobin is between 70 to 100 grams per litre, then transfusion should be guided by the patient's clinical status. If a patient is preoperative with underlying coronary artery disease, then certainly transfusion of red cells would be appropriate and indicated in this setting. This guidelines has recently been reviewed and updated, and it's now been categorized into different clinical scenarios. The module that will be relevant for orthopedic surgery would be the perioperative blood management guidelines, and that's due for publication next week. And that can be found in the National Blood Authority website. Moving on to our methodology of this audit, 41 hospitals from the states of Victoria, Tasmania, ACT and Northern Territory were invited to participate, and these hospitals would regularly perform orthopedic surgery. Each hospital were asked to collect 30 consecutive elective hip and knee replacement surgeries conducted in 2009. And the data was collected into a standardized data collection form and was then reviewed by 2 independent medical reviewers. At this juncture, I thought I should probably point out that our audit does have quite a number of limitations. It is a retrospective study, and the number of patients are relatively small, and as such, the power of this study, there's no power in this study to be statistically significant in many aspects, but we do think that information provided from this audit is useful and valid, and would be interesting to compare what happens locally in terms of red cell usage. The benefit of this audit would be that there is a good cross-section of data which included both public and private sectors, and that would be quite interesting to compare as well. Moving on to the demographics of our audit, there were 30 hospitals who contributed to the audit in total. 4, however, had to be excluded because their data collection did not comply with our methodology. Of the 26 hospitals included, there were 20 from the public hospitals and 6 from. And that gives rise to a total of 755 episodes of care in our audit. There is a slight predominance of female to male patients in our audit in a 3:2 ratio. The average patient age is about 70 years old, and half of them would have at least one comorbidity. And I think that's a good reflection of the typical patient demographic that we see in most hospitals. In terms of procedure, it's pretty much split down the middle between hip replacements and knee replacements. Moving on to findings, the first point, the overall transfusion rate is 32%, and this is quite similar to our previous audit in 2005 and certainly comparable with many international reports. That said, there is a wide inter-hospital variation in transfusion rate from as low as 10% down to as high as 7%. And there is also quite a wide transfusion rate by procedure as noted by this graph. And understandably, the hip replacement group would have a higher rate of transfusion, particularly so in the revision hip replacement. The knee replacements would have a lower rate of transfusion. Of note in our graph, the revision knee surprisingly had quite a low rate of transfusion as compared to the previous year, and we think that might be reflected from some of the missing data that we had in this in a knee replacement group. And in addition, there was quite small numbers in this group anyway. Moving on to alignment of transfusion practice with clinical guidelines. There is, again, quite a wide inter-hospital variation ranging from 23 to 100%. However, overall, the majority of the transfusions work consistent with recommended guidelines, and there's certainly an overall trend to improvement in this area compared to previous year. Having said that, this finding is not statistically significant. Blood conservation strategy is not something that's commonly applied, and blood conservation strategy that's mentioned here would be the intraoperative or post-operative cell salvage technique, as well as preoperative autologous donation. We'll talk about the cell salvage technique first up. There's only 14 hospitals out of the 26 who participated who employ these cell salvage techniques, and most of them are used in a post-operative setting. Another point is there's no measurable impact of cell salvage use on the frequency of blood transfusion seen. In terms of preoperative autologous donation, this is again used in a very minority of patients, and most of them are seen in the private sector. Preoperative autologous donation is noted to have an increased risk of patients with preoperative autologous donation are noted to be twice as likely to need transfusion, and this is comparable with other international reports as well. Preoperative anemia is another variable that's been found to increase the risk of transfusion, and this again is a statistically significant finding in our audit. Overtransfusion rate, again, there's quite a small number of patients that's been found to be overly transfused to post-transfusion hemoglobin 115 grams per litre. Most of the overtransfusion cases were found to be in the intraoperative or within the first 24 hours post-operatively. There is an overall trend to reduction in the rate of overtransfusion compared to our 2005 audit. In summary, this is a retrospective study with a number of limitations. That said, we observed that the transfusion practices are quite similar from 2005 to 2009. There is a wide variation in transfusion practices across different hospitals, and the routine use of autologous donation increases the risk of transfusion and is hence not recommended. And another point is preoperative anemia increases the risk of transfusion as well. I'd like to acknowledge the members of the Blood Matters program who has worked very hard to put this audit together, as well as the expert of Dr. Maria Borosak in the Blood Matters program, and not forgetting all the hospital who's contributed to this audit as well. I'll leave you with this last slide, which is where you can find this audit. Ultimately, it's due for publication in 2 weeks' time.